here. Good morning to everyone. Welcome to Beyond the Plate, exploring the mind and food connection. This is a timely, powerful discussion brought to you by Lake Health and Wellbeing, and we're so glad that you could join us today. My name is Jay Robinson, and I am the project assistant here at Lake Health and Wellbeing, and I'll be helping our guest speaker just with some housekeeping while we're here in the webinar. This webinar is part of our Roots to Resilience mental health program, which runs from May all the way to July. And this is one of a series of workshops where we're just empowering people for their mental health awareness. We do this by providing tools and conversations and practices that help build emotional strength and holistic well-being. So as your host, I will guide you through this important session, and we'll be exploring our food choices, not just for our bodies, but also for our minds. So I am honored to introduce our speaker today, Ms. Genesia Pemberton, RD, Registered Dietitian. She is a registered dietitian with the Board of Nutrition and Dietetics in Trinidad and Tobago. She currently serves as a nutrition officer for the Nevis Health Promotion Unit and is a passionate youth health advocate here at Lake Health and Wellbeing. And she believes deeply in the role that nutrition plays in shaping our mental health, especially for young people. Her holistic approach reminds us that nutrition is not just about what's on our plate, but it's about how we feel, how we cope, and how we thrive. So before I bring Genesia on, I just want to give a few Zoom instructions for how the webinar will go. The presentation will be about 2 hours, and we'll have a break in between. Feel free to post your questions in the Zoom chat. We do have Abby, our program director, in the background helping out with the Zoom chat. So don't worry if you do have a question and you post it there. We will get to the questions and answers in between the session and at the end. The session is being recorded, and it will be shared with all of the people that registered. And again, if you don't mind, please stay muted just until it's time to speak, so if you don't want to get a whole lot of background noise. So without further ado, I bring to you Ms. Genesia Pemberton. Genesia.
Okay, good morning. Thank you so much today, Jay, for the introduction, and welcome everyone to today's session. My name is Genesia Pemberton. I'm a registered dietitian and nutrition officer for the Nevis Health Promotion Unit. So we're about to explore a topic that's incredibly relevant but often overlooked: the powerful connection between what we eat and how we feel, not just physically, but emotionally and mentally. So today's session, Beyond the Plate, is all about exploring this connection, understanding how nutrition, emotions, and mental health are deeply intertwined, and learning how to create a healthier, more mindful relationship with food. So here's what we'll be covering today. We'll have an icebreaker, which is a quick activity to get us thinking and engaged. Part 1, understanding eating disorders, so what they are, the risk, and the impact on our health. And part 2, we'll be building the awareness of personal eating patterns. So we're going to be identifying habits and emotional triggers. Then we're also going to be discussing the coping strategies, which are the tools to manage stress and improve our relationship when it comes to food. Then we'll have a quick activity, a hands-on reflection to apply what we've learned, as well as the conclusion and the opportunity for questions and answers. So for our icebreaker session, I would invite everyone to, if you're able to scan the QR code, and it should take you to our Mentimeter, where we will take part in the icebreaker activity. And you will also be able to access the link if you are unable to scan the QR code in the chat. So I'll give you some time to scan, and then we'll transition to our icebreaker activity. So you could put a thumbs up or our message in the chat if you've accessed the icebreaker. So we'll give you a minute and then we'll transition.
We are also going to post the link to the Mentimeter in the chat. I think it's already posted there. If you're not able to access it through your phone, so the link is also there as well.
Okay, so I'll transition to the Mentimeter. Okay, so we just want to get some interactions. Are you seeing my screen?
Yes.
Okay, so we'll start by finding out what country are you joining from. So we have Grenada, USA, Tortola, St. Kitts, BVI, the Virgin Islands, Anguilla, of course, St. Kitts and Nevis. And welcome. And then we will transition to what are you hoping to gain from today's session? So I want to hear your feedback, what you're hoping to gain from today's session.
So here, guys, for the next few minutes, if you'd like to come off mute and maybe say a couple of words about what you want to gain, that's fine. I know sometimes on the Mentimeter, maybe might go a little too quickly. So if you want to come off mute and maybe just say a couple of things.
Yes, yes. Increased knowledge, better awareness, some information, living a healthier lifestyle, motivation to eat well. Okay, great. And I hope you're able to take away something from today's session, especially when it comes to healthier lifestyle, food, mental health link, enlightenment. Okay. And so now we'll transition to the other questions. What is your understanding, if any, of an eating disorder? So what is your understanding about eating disorders? Are you aware of any aspects, any topics, any issues when it comes to eating disorders? If no, you could say no. If yes, you could say yes. If you do know something, then you could also share that in the answers. And if not, of course, we are here to learn today. Okay, so what is your understanding of an eating disorder? It makes you ill. Next, what role do you think nutrition plays when it comes to mental wellness? So what role do you think nutrition play when it comes to your mental wellness or mental health? Do you think nutrition has a role to play? It influences your mood. It can make you cranky. Which are all good answers. And the idea is, yes, there is some role to play. Your focus, it improves your mood. Okay, so those are all good answers. And hopefully I'll be able to provide some clarification today. Brain function, good. Okay, so these are all good answers, and I'll be able to provide you with some clarifications. Thank you guys so much for sharing, and we will be continuing this session. Connection between the gut. Really good answer. Balance. Okay, thank you guys so much for sharing. These are all good answers. And we will return to our presentation. Okay. Okay. So part one, understanding the eating disorders. So in preparing for this presentation, there were many different angles to explore when it comes to mental health and its influence on our eating habits. So my goal is to cover a range of important topics in a concise manner and also share some strategies because our mental state can significantly affect what we eat and how we approach food. Understanding this connection is important for making healthier choices. There's a growing need for mental health support worldwide. Mental health encompasses our emotional, the psychological, and social well-being. This affects how we handle stress, how we relate to others, and make decisions. And understanding mental health is the first step to taking care of it. So what are some things that we face in reality that can affect or be a factor or influence in our eating habits? So we are living in a fast-paced modern world, a developing region, along with the rise in technology and cultural changes. The more our societies develop and the more we grow, the more we shift away from traditional diets and wholesome foods. This can lead to unhealthy eating habits, which include eating too many high calorie, high salt, high fat, sugary, processed foods, which can cause a lot of health problems and diseases. We have also shifted from doing physical activity and labor to an urbanized way of living. And simply, we don't do as much physical activity as we were once used to. We're also faced with healthy eating obsessions. While trying to eat healthy is a good thing and it's good for most, some people become overly obsessed with it, and this obsession can interfere with their daily lives. On the other hand, we also have food avoidance issues when someone stops eating foods that they used to enjoy or cut out entire food groups. The culture of dieting and obsessing over food is common, but it raises question about when this focus on diet and weight becomes unhealthy. Lastly, mental health issues. Depression and anxiety are becoming major global issues affecting many people. So let's look at some data that may help us to understand the importance of this topic. So mental, neurological, and substance use abuse accounts for 13% of the world's disease burden. So it exceeds both cardiovascular disease and cancer burdens. Mental health problems affect 10 to 20% of young people around the world. Between 2000 and 2018, the prevalence of eating disorders in the general population has more than doubled worldwide. 1 in 3 people with eating disorders is male, with an estimated 10 million males affected during their lifetime. Recent data published from the Caribbean Public Health Agency, CAFA, in 2024, where they shared their insights on mental health and public health strategies in the Americas, concerning trends about mental health in our region, they revealed that 25% of Caribbean adults have a diagnosable mental health condition, with 60% never receiving treatment. A significant 70% treatment gap exists across the Caribbean region for those needing mental health care. Depression and anxiety make up half of all mental health conditions in the Caribbean, and Caribbean adults experience depression rates 15 times higher than the global average. And these statistics show that there is a need for better mental health support and treatment accessibility in our region. So while eating disorders and disordered eating, they may seem similar, they're actually two different things. So we have disordered eating. Disordered eating is a descriptive term. It's not a clinical diagnosis. It represents a spectrum of problematic eating behaviors. It includes distorted attitudes about food, weight, shape, and appearance. And it may vary in terms of the severity, but it doesn't meet the full eating disorder criteria or the diagnosis criteria. Then you have eating disorders. These are complex mental illnesses. It must be diagnosed based on a diagnostic criteria, and it's characterized by persistent disturbances in the eating behaviors. It includes significant impairment on your psychological function, and it must meet the specific criteria defined by the American Psychiatric Association. So even if eating concerns don't meet the diagnostic criteria for an eating disorder, they still deserve attention and treatment. So these patterns can carry health risk and may develop into eating disorders if they are left unaddressed. So let's explore the main types of eating disorders that are clinically recognized. So we have anorexia nervosa, and that is characterized by extreme food restrictions and fear of weight gain. There's also a distorted body image, seeing oneself as overweight despite being underweight, and often includes excessive exercise and can lead to severe malnutrition and medical complications. We also have bulimia nervosa, which is an eating disorder marked by a cycle of binge eating large amounts of food in a short period of time, followed by behaviors to prevent weight gain. So people with bulimia, they often feel out of control during their binges and use unhealthy methods to compensate. So those compensatory behaviors include purging. So they would have self-induced vomiting. They would also misuse laxative and diuretics as well as enemas. Also fasting or excessive exercise to make up for the binge eating. There's also secretive behavior where the binges and purges often happen in private, and there's a feeling of guilt, shame, or disgust after the episodes. And in terms of body image distortion, there's intense fear of gaining weight, and their self-worth is overly tied to their body shape and weight. We also have binge eating disorder. So this is regular episodes of eating large quantities of food, feeling a loss of control during the binges, and often eating rapidly until they feel uncomfortable, and there's feeling of shame, guilt, and distress. In binge eating, the only difference with the bulimia is that there's no compensatory behavior. Then we also have avoidant restrictive food intake disorder. This is where you have limited food intake, so a little bit of food due to sensory issues or fears about eating. This results in nutritional deficiencies or weight loss and may require nutritional supplements and impacts the psychological function. So many people may experience disordered eating patterns that don't fully meet the criteria. But as we mentioned, this doesn't mean that it should not be addressed. Other specified feeding or eating disorders includes eating disorders that don't meet the full criteria for diagnosis. They're equally serious and require professional treatment, and they can cause clinical distress and affect your social, your occupational, and other areas in life. So these are conditions where you have atypical and anorexia, atypical bulimia, atypical eating disorders. And the only difference is that you don't have perhaps the compensatory behaviors or the body image issues, right? Then there's unspecified feeding or eating disorders. These are used when the symptoms cause significant distress, but they don't fit any of the other categories. Clinicians usually choose not to specify the exact reason for diagnosis, and typically this is done whenever you're in an emergency situation and you can't diagnose the individual. You also have pica. This is when someone persistently eats non-food items that do not have any nutrients for over a period of 1 month. It is not part of the culturally supported or social norms in terms of what they're eating, and it is considered sufficiently severe if the eating behaviors occur in context of another mental health disorder. So it may be linked to autism, schizophrenia, and pregnancy. Then we have rumination disorders. This is when someone repeatedly regurgitates food for over a period of at least 1 month, right? And the regurgitated food may then be rechewed or reswallowed, or they may spit it out. This is not caused by an underlying medical condition or any gastrointestinal issue. So it does not occur during anorexia, bulimia, binge eating, or avoidant restrictive disorders. And it's considered severe, however, if it is linked to a mental disorder. Lastly, we have emotional eating, which a lot of persons do struggle with. So emotional eating is the tendency to overeat in response to negative emotions such as anxiety and irritability. Unlike eating disorders, emotional eating is a behavioral response that doesn't necessarily involve complete loss of control over the food quantity or quality. So the key characteristics, it affects both men and women across different lifestyle stages. It's linked to psychological factors like depression and anxiety. It's associated with unhealthy dietary patterns. It often involves high fat, high sugar foods or comfort foods. And stress from emotional eating can reduce your awareness of natural hunger or fullness signals. And people of normal weight who emotionally eat, they tend to consume food less during emotional episode compared to those who are overweight or obese. And that could also be possibly linked to the body's signals not being aware that it is full or you're hungry because you're so stressed out. So what are the possible signs of an eating disorder? That may include being overly focused on your body shape, your muscle mass, and imperfections. Additional signs include steroid use, somebody who has an excessive time spent exercising at the expense of other activities. If you realize someone is heading to the restroom immediately after eating, following a strict eating routine. Physical signs also include significant loss of weight or rapid instabilities in weight, experiencing persistent tiredness. In females, there may be disruption in their menstrual cycles, or not being able to concentrate effectively. There may be increased sensitivity to cold, and there's the occasional bouts of dizziness leading to fainting. In terms of behavioral issues, you may realize they're consistently cutting back on fat, consistently tracking calories, skipping meals, fasting, or avoiding specific food groups. Also engaging, as we mentioned, compulsive exercise, compulsive self-weighing, and avoiding social gatherings when in reference to food. Emotional signs include mood swings, irritability, anxiety around meal times, expressing negative self-worth, depression, or social isolation. Now, eating disorders don't just affect how someone eats, they can cause serious physical and mental health problems across the entire body. So it affects your health, your heart health, and that may cause slow heart rate and low blood pressure, irregular heartbeats, higher risk of heart failure. It may also affect your metabolism and kidneys, and that may cause electrolyte imbalances, and that could also damage your organs, severe dehydration and kidney issues, bone health issues, which causes weakened bones or a higher chance of broken bones. And you also have mental health issues such as higher rates of depression, anxiety, and feelings of isolation and social withdrawal. Other complications include constipation, the erosion or breakdown of your dental or teeth enamel, and that occurs as a result of vomiting, as well as low testosterone levels in men. So who is affected by eating disorders? Eating disorders can affect anyone regardless of their age, their gender, their ethnicity, or socioeconomic status. However, certain groups may be more likely to get an eating disorder. In terms of age groups, adolescence is a period of great and rapid changes in students' physiology, their body shape, and their habits. Many health-related bad behaviors would appear in this period, which increases the risk for mental health problems. Adolescents and young adults between the age of 13 to 25 are most commonly affected. Children as young as 6 can also develop eating disorders. Middle-aged and older adults can also develop the condition. Then you have gender. While historically eating disorders are associated with women, people of all genders can develop eating disorders. So men and boys are increasingly seeking treatment for these conditions. The common misconception that eating disorders only affect female can mean that males often arrive to treatment later in the disease process. Physical signs and behaviors of this disease may be inadvertently missed by loved ones, by school staff, or sometimes busy health professionals. This, along with secretive nature of eating disorders, may delay the acknowledgement of the disease and the need for help. Consequently, males may become more ill as more time passes. You also have LGBTQ plus individuals who face higher rates of eating disorders. Persons at a higher risk also include athletes and performers in weight-sensitive sport activities, people with family history of eating disorders, individuals with perfectionist personalities, and those experiencing high levels of stress or trauma. Okay, so now we will transition into part 2 of the discussion, where we will be building the awareness of personal eating patterns.
Genesia.
To build a hi.
Hi. So right here, guys, if you have any questions that about the eating disorders that Genesia mentioned, please don't hesitate to put them in the chat. It was a lot of great information, and I know some of it may pique some interest in some questions. So please don't hesitate to put your questions in the chat if you have any questions about what you just spoke of. And yeah, just go ahead and put the information in the chat. Thank you.
Thank you so much, Jay.
You're welcome.
Okay, is it okay to transition?
Yes, go ahead, my dear. Transition. I just wanted to give a quick pause so people could gather their thoughts on it.
Okay, then, no problem. Okay, so in terms of your personal eating patterns, to build a healthy relationship with food and improve our mental wellness, it's important to first understand your own eating patterns. So we'll break this down into several parts. So number one, you want to track your food and mood. So notice when and why you eat. Pay attention to how different foods affect your mood and keep a simple food diary to spot patterns. Look at your environment. Where do you usually eat? Do you eat at the desk? Do you eat in front of the TV? Do you eat with family? Also, who do you eat with and how fast do you eat? Common patterns to watch for include skipping meals, especially breakfast, eating mostly snacks instead of regular meals, frequent fast food consumption, stress eating or emotional eating, and restrictive dieting. So let's explore the things that may trigger emotional eating. So there are many misconceptions about eating disorders that can contribute to stigma, stigmatism, attitudes, and beliefs. Common myths and misconceptions about eating disorders include eating disorders are a lifestyle choice. Everyone diets and it's normal. Only girls or specific groups have eating disorders. Eating disorders can be fixed by just eating better. You must look a certain way to have an eating disorder. And eating disorders are just for attention or a phase. So what are the things that tend to trigger these patterns? Peer pressure. So the media influence. Many young girls feel pressure to look a certain way because of what they see in magazines, TV, and social media. This pressure can make them think their worth is tied to their appearance. Boys and men, they also face pressure to have a specific body type, like being athletic or having low body fat. This can affect how they feel about themselves. Then you have these socio-cultural issues like the diet culture. So we constantly hear about healthy eating, dieting, and weight loss from the media and influencers. These messages can push people to change their bodies or to buy products. Dieting can lead to unhealthy eating habits and make you feel deprived, affecting your mood on a daily basis. It's important to remember that our bodies need to be fueled at least 3 times a day. There's also fat shaming, where you have the war on obesity, and that could lead to negative feelings about the body image, making people unhappy with their bodies and more focused on dieting. We also have the environmental issues, such as traumatic events, for example, experiences like bullying, natural disasters, or loss of loved ones, and that can lead to disordered eating. Some people may diet to cope with situations as a way to regain their control. You also have stigma and the misconceptions. So stigma is the shame and the discrimination of people because of certain characteristics or conditions. And that could prevent persons from seeking help. According to CARPHA, the Caribbean Public Health Agency, they found that there's a gap existing in our region's healthcare system because of stigma, because of scarce resources, and our systems not being designed with early interventions or community care in mind. Disordered eating is complex and involves more than just the personal choice. There's also the biological and the psychological factors that play a role in the development of these eating disorders. In terms of the biological factors, the genetics. So disordered eating and eating disorders can be caused by genetics, or how you were born. You were born with it. They are not just choices people make, they are conditions that can run in families. You also have the neurobiological or hormonal influence. So the biological aspect and the hormonal imbalances play a significant role. For example, you may have a disruption in your appetite or how it is regulated, and imbalances in serotonin, and I'll get into what that is, in your brain, and that can lead to disordered eating. There's also the psychological factors where you have personality traits. Certain traits are commonly found in individuals with eating disorders, such as low self-esteem, negative body image, perfectionism, and difficulty managing negative emotions. Other considerations also include the issues of depression, anxiety, substance use abuse, as well as post-traumatic stress disorders. Also, just for some quick background, UNICEF published a study on the Latin America and the Caribbean titled Social Norms, Nutrition and Body Image in Latin America and the Caribbean. So they were studying, these are more Hispanic countries, Colombia, Guatemala, and Mexico, just to get insights on nutrition and the experiences and views on body images. So I pulled the key findings. So the key drivers of nutrition and body images in the Caribbean included family and community influences. So family, your friends, and your community norms, they all play a role in shaping your attitude towards food and health. Also, parents are a great influence on their children's eating habits, and that often leads to them adopting unhealthy practices at a young age. Also, many adults and adolescents eat snacks as a reward to fill cravings for something sweet. And then you have the food access. So many Caribbean communities rely heavily on commercial food chains, increasing our exposure to ultra-processed foods. And this can lead to food swamps. So these are just areas where you have limited access to nutritious foods, and that would contribute to a higher rate of obesity and overweight and obesity. We also have social norms where the cultural messages about body image and health can pressure individuals to conform to unrealistic standards. And that often is perpetuated in the media, in social media. And the goal isn't to judge these patterns as good or bad, but to understand them and why we do what we do. So you can make mindful choices that support both your physical and your mental health. Okay, so we'll now take a break, a 5-minute break before we continue. If you do have any questions, then feel free to ask.
Genesia, there was one question in the chat that I'm glad that a participant brought up, because it also was distinct to me when you mentioned the difference between disordered eating and eating disorders.
Yes.
Yeah. I didn't know that that was a thing, and I'm thinking that that was a really good distinction.
Yes. And so you do have some that are, it's basically the eating disorders are clinically diagnosed by a health practitioner, and there are certain patterns that persons would exhibit. Sometimes it is out of their control. And so the distinction with the disordered eating is that it's not something clinically. It may not be that the individual is suffering from anxiety. Maybe it's not linked to depression. It could be linked to simply because the your community, the society that you grew up in, you are expected to look a certain way. And because there's that expectation, then you would then adopt a specific eating pattern. Or if you know within a specific community, persons are accustomed to eating a certain way, persons may not realize that it is unhealthy, but that's just the norm within the community or society. So there's no specific clinical diagnosis for it. It's just a behavior.
Okay, so disordered eating is more behavioral, while eating disorder is more a diagnosis.
Yeah,
Thank you.
no problem.
Okay, so yes, we'll take the 5 minute break. We will just to stretch your legs, or maybe if you do have any questions, or if you're taking notes and you want to bring them up, we can just do that here. Genesia will start back speaking again in about 5 solid minutes. So go ahead and do a little stretch, take a little breath, and we'll come back. Guys, we're going to get started in about 2 more minutes. Just give everybody a chance to settle back in, and we'll get started in about 2 more minutes with our workshop. Before we jump into the next section, if you do have questions, we can go over those before we jump in. So I'll pull up the questions that you've typed in the chat, and we'll go over those. So this is a good time to get your questions in. All right, good people. Welcome back to our Roots to Resilience, our Exploring the Plate workshop with Miss Genesia Pemberton. We're going to go into our second half. So welcome back and thank you again for being here. If you are just joining, I am Jay Robinson, the project assistant here at Lake Health and Wellbeing. And we have our guest speaker today, Miss Genesia Pemberton. Before we go into it, we did have one question that we had through the break. I'll read it out, and I'm sure Genesia is going to get to this part. But one question that was asked, Genesia, before the break was, is there anything that schools or that us at Lake Health and Wellbeing can do to help the situation with eating disorders? Thank you for that.
Thank you so much for the question. So there is this in terms of awareness, because some persons are simply not aware that some of the patterns or the eating habits that we do display would be unhealthy because it's the norm, and so we don't see a problem with it. So education and awareness is something that the schools, as well as governmental, non-governmental organization, as well as the government and public health, we have to do more in the sense of ramping up the awareness within our community of these issues, right? So in terms of the unhealthy eating patterns, in terms of our body image, being able to have also individuals who are qualified or knowledgeable of these issues, and then deploying them and educating the public about them. In terms of the schools, of course, do we have enough professionals within the schools, counselors, nurses who are aware of these issues? Do they know how to detect eating disorders? Do they know how to identify them? If they don't, what can we do in terms of increasing programs to make persons more aware so that they are able to diagnose these issues and then be able to treat the conditions? And also, as a community, as Kafa would have mentioned, we do have a lot of stigma. And so what can we do to create a supportive environment for persons? So do we have that support? Do you have the counselors present, or persons there, even your peers, friends, the parents, other groups who can be able to provide support to persons? And then in terms of policies, what can we do in terms of policies to address the mental health gaps that we are facing in public health? So do we need to strengthen the policies? Do we have policies that are making sure that we address the issues that perhaps young persons are facing, as well as the community in general? So there is a lot that we can do, and it starts with raising the awareness of the issues.
Thank you for that. Thank you for the question and wonderful answer, Genesia. To you.
Okay, thank you so much and welcome back, everyone. So we are going to go into the coping strategies that persons can use in order to manage these conditions. So we will start by how nutrition connects to the mind and body. So nutritional psychiatry, this is a growing area, and that studies more so what we eat and how that affects our mood, our behavior, and mental health. So more research now shows that the diet plays a big role in preventing and even helping treat mental health conditions like depression and anxiety. While eating disorders have different features, there are similarities in terms of the nutrition management for these disorders. So in today's world, our eating habits have changed a lot. Many people eat more processed, high-calorie foods that are low in essential nutrients. At the same time, we tend to eat fewer fiber-rich vegetables, whole grains, and other healthy foods. So these poor dietary patterns, they are often combined with other unhealthy lifestyle habits. For example, the lack of physical activity or excessive drinking or smoking. And of course, together, those behaviors can contribute or can result to higher levels of obesity and low intake of essential nutrients like vitamin B, zinc, and magnesium. And those are the nutrients that play an important role in the brain and the nervous system function. So why does this matter? Because what we eat directly affects our brain health. A poor diet can lead to mood disorders like depression and anxiety, as well as problems with memory, focus, and long-term cognitive performance. Obesity has been linked to an increased risk for depression as well as Alzheimer's disease. Even young people who are not overweight can show signs of mental fog and cognitive decline if they have poor blood sugar regulation, suggesting that the brain health can be affected early in life, long before any physical signs or illness appear. The connection between diet, body, and brain is complex, but important to understand. So poor nutrition and excess weight can also cause inflammation and the reduced blood flow to the brain. Hormonal imbalances, such as high insulin or cortisol levels, can also disrupt your brain chemicals and that regulate your mood and your mental clarity. Additionally, there's a connection with your gut and your brain. And that is how your health, the health of your digestive system influences your mental state. And that is now recognized as a major factor in terms of mental health. In places like St. Kitts and Nevis, we see these trends clearly. So people are eating more fast food and sugary snacks while their intake of fruits and vegetables as well as whole grain remain low. As a result, obesity rates are rising, and with them, the risk of mental health problems is growing too. So this is a serious concern as it shows how diet-related health issues are no longer just about weight, they affect your mental health and your mental well-being as well. And then we also have to think about and consider the role of parents. So the way parents feed their children in the first years of life can shape their relationship with food and emotions. Feeding is not just about nutrition, it's a form of communication between parent and child. When parents respond to hunger signals correctly, babies learn to recognize real food and understand when they are full. When feeding becomes confusing, if parents misread their child's needs, like offering foods when the child is tired or upset, it can confuse the child. This confusion makes it harder for the child to separate physical hunger from emotional discomfort. Over time, this can lead to unhealthy eating patterns and emotional eating later in life. Okay, and if you do need any clarification, do let me know. And any questions? So in terms of food mood regulation, emotions are controlled by the brain, not the heart. A key area in the brain involved in mood is the hippocampus, which helps to regulate emotions and memory. Studies show that people with depression, if they do have depression, the hippocampus is usually smaller, especially after repeated episodes of depression. One reason for this may be because of chronic stress, which slows down the growth of new brain cells, which are called neurons in the hippocampus. Studies also show that antidepressants may improve mood by boosting the growth of new neurons, which increases certain brain chemicals or neurotransmitters. It's not just about having the right chemicals. Healthy brain connections and nerve growth are also critical. So how does nutrition affect your mood? The brain is mostly made of fat, and it needs healthy fats to grow and function properly. Nutrients are essential to make those transmitters and support the brain health. So key nutrients include amino acids that comes from proteins, minerals like magnesium and zinc, as well as B vitamins, especially B6, B12, and folate. Without these nutrients, your body can't produce enough brain chemicals, and that can lead to mood problems like depression and anxiety. So what's the problem with the processed foods that we're eating? Processed foods high in sugar are addictive, and that stimulates the pleasure centers in our brain. This trains our brain to crave more of them instead of nutrient-rich options like fruits and vegetables. These foods can cause inflammation in the brain, they can disrupt mood regulating systems, and they're linked to anxiety and depression. So emotional eating habits can make your mental health worse. And the cycle is hard to break, as we discussed. For some persons, when they are stressed or sad, people often eat too much or too little. Overeating, of course, results to sluggishness and weight gain. Undereating results to tiredness and poor brain function. So there is a chaotic cycle here. Now we are also going to talk about the neurotransmitters, serotonin, and what is the relationship between your gut and your brain. So 95% of serotonin, so serotonin is a mood regulating brain chemical. It is made in the gut, not the brain. The gut contains millions of neurons and is directly linked to emotions. A healthy gut microbiome, so this is the bacteria that is in your gut, it supports serotonin production and emotional balance. The gut microbiota, so that is the bacteria in your gut, helps to reduce inflammation. It improves your nutrient absorption, and it produces those key neurotransmitters like serotonin and dopamine. So it supports your immune system. And an unhealthy gut due to poor diet or stress may lead to inflammation, emotional distress, and psychiatric problems. So do we have any questions here? Or is it okay for me to move on?
Don't forget, guys, you can post your questions in the chat if you don't want to speak them aloud. There we go. Thank you, Hillary. Hillary said, I'm interested in knowing more about a vegetarian diet. Oh, I'm sorry. It kind of went off. Give me 1 second.
I can read it. So I'm interested. So Hillary said, I'm interested in knowing how a more vegetarian diet positively influences our mood.
Okay, thank you so much, Hillary. So as we get into this session, I'll be able to give more input. We'll show how eating more healthier, wholesome foods, which you will see in the vegetarian diet, how it's beneficial, right? So hopefully as we go on, I'll be able to clarify that for you, Hillary.
Thank you for that. And thank you for your answer, Genesia. I think you can move on.
Okay, thank you. Okay, so what are the nutrients that support mental health? So when it comes to these recommendations, I would recommend that you consult your healthcare provider or dietitian before implementing any of these recommendations. So there are certain nutrients that are beneficial for mental health. So there's one called the S-adenosylmethionine, and that's also called SAMe. So this is a nutrient that supports mood regulation and may enhance the effectiveness of antidepressants. Then there's also something called N-acetylcysteine. And so this acts as an antioxidant, and that may reduce symptoms in psychiatric disorders by promoting or protecting the brain cells. And this is found, so all of these items, they are found more so in the healthier food options, which I will be able to distinguish for you where the sources of these items are. Then you also have polyunsaturated fats. And so this is more so omega-3 fatty acids that is found in fatty fish, flax seeds, walnuts. They have anti-inflammatory effects and may protect the brain cells. And deficiencies are linked to early stages of psychotic disorders. So remember, I mentioned that the brain is made predominantly of fat. And so the healthy fats would be these omega-3 fatty acids. So if you don't get enough, of course, that could also influence psychotic disorders. So the supplementation has been shown to lower the risk of developing psychosis in high-risk individuals. You also have zinc. So zinc plays a role in mood stabilization. Low zinc levels are linked to more severe depression, and it works best when combined with antidepressants, and it's found in poultry, seeds, nuts, and legumes. There's also the B vitamins. So it's important for healthy nervous system function, and folic acid deficiency, or if you don't get enough folic acid, that is linked to poor response to antidepressants if you do take antidepressants. And it's also found in things like avocados, mushroom, leafy greens, eggs, and wheat flour. Then you also have vitamin D, which supports the overall brain function and mood. And low levels are associated with depression and schizophrenia. We also have the probiotics. So probiotics are bacteria, the good bacteria that are found in your gut. Right, so those include things like yogurt, kefir, or kefir, sauerkraut, and kimchi. So these are fermented foods. They are shown to reduce the gut symptoms under stress. They lower stress-related nausea and abdominal pain, which persons, when they tend to get stressed out, they may experience nausea. Improve anxiety and depression when specific strains. So there are specific strains like lactobacillus and bifidobacterium. So specific strains are very, very beneficial. And prebiotics. Now, prebiotics, those are the non-digestible food fibers that feed good bacteria. So these would be more so linked to those plant-based foods. And so things that are like multigrain products or plant-based foods. They help to promote healthy gut flora, so that is the healthy gut bacteria. They prevent the growth of harmful bacteria, and they reduce inflammation by supporting the brain function. They are also psychobiotics, and they are specific probiotics that help your mental health. And those include your lactobacillus helveticus or bifidobacterium, right? So they may reduce anxiety and depressive symptoms, stress hormone, cortisol levels. These may work as a helpful addition to standard treatments like antidepressants or antipsychotics. There are also herbal complementary alternative therapies, so herbal medicines. But I would just like to caution that you should consult your health practitioner or dietitian before implementing any of these recommendations. So what are some coping strategies? Improving your eating habits for mental health isn't just about food. It's also about learning to understand your emotions, make thoughtful choices, and treat yourself with compassion. Small changes done consistently lead to big improvements over time. So number one, pay attention to the foods that affect you. You can try eating a clean diet, which is a diet that is free of ultra-processed foods for 2 to 3 weeks, and or eating a diet that is more so vegetarian-based. Notice how you feel, not just right after eating, but the next day too. Slowly reintroduce foods one by one to see which ones make you feel better or worse. Number two, practice mindful eating. Learn to listen to your body's signal. Eat when you're hungry and stop when you're full. Be present while eating. Chew slowly and avoid distractions like your phone or the TV. Healthier snacks. Also, you might choose healthier snacks and make more conscious choices and prevent overeating. Then you also have number three, understanding emotional eating. Recognize when you're eating because of your emotions, not hunger, without judging yourself. Track triggers by keeping a food or mood diary. What were you feeling when you eat? Once you see the pattern, you can find healthier ways to cope. Number four, find non-food ways to cope with emotions. Instead of eating, try these activities based on how you feel. When it comes to stress, take deep breath, meditate, and go for a short walk. When you're lonely, call, text, or video chat with a friend. When it comes to sadness, watch something funny, write a gratitude list. When it comes to boredom, read, do a hobby, start a small project. And when it comes to anxiety, spend time with your pet, talk to a friend, and consider therapy. Number five, use therapy and emotional support tools. So psychotherapy includes cognitive behavioral therapy, acceptance and commitment therapy, and dialectical behavior therapy. So these are tools that teach you how to manage your emotions and reduce stress eating. Learn to accept emotions instead of avoiding them with food. Use self-care support or social support and physical activity instead of eating to feel better. Number six, be kind and patient with yourself. Progress isn't always a straight line. Some days will be harder than others. Give yourself credit for small wins. Remember, changing emotional habits or emotional eating habits take time, but it's worth it. Then move your body. Exercise can reduce stress, boost mood, and help regulate your appetite. It doesn't have to be intense. Even short walks or stretching helps. Then you have some convenient meal planning tips, and those include prepping ahead on good days. When you have more energy, prep meals or snacks in batches. Or you could pre-chop your vegetables and cook your grains or proteins in bulk and pack them in snack bags. Freeze meals in portions for the tough days. Create a go-to meal list. So keep a list of 5 to 10 easy, safe, and recovery-friendly meals you can rotate. Or you could use the grocery shortcut. So you can purchase pre-cut vegetables, or you can purchase rotisserie chicken, frozen fruits and veggies, or ready-made meal kits, which can save you time and energy. Look for minimally processed items that still support a balanced plate. Then don't skip meals when you're tired. Skipping meals can lead to energy crashes, increased anxiety, and binge eating episodes later. Keep low effort meals available to avoid skipping to avoid skipping. For example, so that would include protein bars or pre-made smoothies. Plan your meals around your energy levels. Schedule lighter effort meals for days you know you will feel drained. If mornings are harder, then prep breakfast meals at night, like overnight oats or boiled eggs. Also, lean on support. So ask a friend, a family member, or support group to help with planning or shopping. If working with a therapist or a dietitian, then they could also help you to plan your meals and get by. So then here is, if you do have any questions, you could share them in the chat and I'll answer accordingly. But here are some tips that we can use. So this is a helpful tool that is from the Chronic Disease Self-Management Program workshop, which this is a 6-week workshop offered by the Nevis Health Promotion Unit. And the workshop basically aims to help persons with self-management strategies in managing their chronic disease conditions. And that is available to the public. We do have sessions that are scheduled. But the tool that I want to focus on is called the problem-solving tool. So problem-solving is one of the most important tools for self-management. Jay?
I know you have paused for a moment to ask about questions, and we did have a couple of questions in the chat. So before you got too far, to bring them up.
Okay, no problem.
Okay, so one of the questions, and you may have covered it, but I just want to make sure I bring it up. It says, can we get more examples of foods which provide the vitamins and nutrients spoken about? I think you kind of covered it, but that was a question that we got, if you want to touch on that. Can we get more examples of foods which provide the vitamins and nutrients spoken about? And then we have another.
Okay. So in terms of the food, so this session would end more so on the food. So I will get into the food and balancing your plate and different items that we could use in terms of the previously recommended or touched on vitamins. So we will get into that as well.
Okay, awesome. Thank you. And the other one we have says, for people that cannot afford a doctor or medical physicians, is there a place that a person can go for this info or any type of person or events?
Okay, so in terms of the information, you do have your at the promotion unit. So that's the purpose of the promotion units, to be able to provide you with this information. And of course, in terms of our public health sector, you do have the access of a dietitian. So in Nevis, I am at the Nevis Health Promotion Unit. The service is free and accessible to persons. You simply need a referral from your doctor. So you can access support in terms of a dietitian, as well as your mental health coordinators. So you do have that service available within public health here in St. Kitts and Nevis. And you will have access to the information.
Thank you, Genesia. Also, for everyone that has registered and has attended this webinar, we are going to send out this as a link, so you can always go back to it and refer to it for the information. So we'll get that link to you, everyone who's here and everyone who's registered. Thank you, Genesia. You can move on.
Okay, thank you so much for the questions. Okay, so then now in terms of your problem-solving steps. So these are the steps that you can use to help solve problems. So if it's related to your diet, here are some steps. So first, what you want to do is identify the problem. This is the most difficult and most important step. For example, someone might feel that poor performance at work is a problem, when the real problem is related to, let's say, fatigue, which is affecting your ability to concentrate on work. Number two, you want to list ideas to solve the problem. Examples of ideas might be to increase your fitness by taking a short walk at lunch. It may mean you need to eat breakfast, eat a more balanced meal. See if there's a place to take a short nap or rest, or call your healthcare provider or pharmacist to ask if any of their medications cause fatigue, or look up information on depression to see if the fatigue is caused by depression. Number 3, select one of the methods to try. For example, taking a walk at lunchtime might help you to become fitter, as well as help to determine if they are depressed, if you are depressed. If depression is causing the fatigue, then they will feel less fatigued after the walk. Number 4, assess the results. If the problem is solved, then great. If not, then you can substitute another idea from the list or of the first. So from the first list, if something didn't work, then you move on to another. Continue assessing the results and substituting the ideas until you've used all the possible items on your list. And after that, if the problem isn't solved, then you can utilize other resources to make another list. You could ask a friend, your family, or professionals for ideas if your solutions didn't work. Then go back to number 3 and continue until you've used all the items on your new list. If your problem is not solved, then we have to accept that the problem may not be solvable for now, and you can revisit it at another time. Problem solving, it helps us to find solutions to some of the problems we have and can be used to help manage disordered eating patterns. So now we're going to get into the food recommendations. So things that we could do in our diet to help when it comes to in coming up with a strategy to manage eating disorders. So the Western diet problem is that it is high in sugar. We eat a lot of processed foods and we eat a lot of unhealthy fats. This can lead to the gut imbalance. It can cause inflammation and higher risk of depression. The diet supports a healthy gut, which plays a big role in mental health. The gut bacteria, the good gut bacteria from fermented and unprocessed foods help to control inflammations in the body. It improves your mood and energy levels. The studies have shown that the Mediterranean diet have a 25% to 35% lower risk of causing depression compared to the typical Western diet. So what makes the Mediterranean diet so healthy? It's full of vegetables and fruits, whole unprocessed grains, fish and seafood, healthy fats like olive oils and nuts, fermented foods, which act as a natural probiotic, and small amounts of lean meat and dairy. And there's no processed foods or added sugars. So what's the bottom line? Eating a Mediterranean style diet can support a healthy brain, as well as, it supports a healthy brain whenever you're able to focus on more wholesome foods, which can take care of your gut. Then you also have the issue of you can use tools, right? So tools like the handy portion guide and the My Plate method helps with meal planning. It's simple and can be useful in supporting recovery from eating disorders and promoting balanced eating. This may help to reduce the anxiety around food and helping individuals to reconnect with hunger and fullness cues. So here's a simple breakdown. In terms of the handy portion guide, it uses your hands. So it allows you to use your hands instead of measuring cups, because sometimes there may be recommendation to use a measuring cups, but we don't always have that. So you could use your hand as a visual guide for portions. It removes the need to count your calories or weigh your food, which can be triggering for some persons. It helps establish portion awareness in a non-obsessive way. It encourages trust in the body and natural cues and reduces food guilt. So how do you use this guide? You want to use a palm size measure to measure things like protein, meat, or fish. Then you have your fist size measure, and that must be used to measure things like rice, pasta, or fruit. Then you have your cupped hand, so both cupped hands, that is used to measure the portion of vegetables, and that is non-starchy vegetables. So these would be your greens, your leafy greens, and so forth, right? So that should be 2 cupped hands. Then you have your thumb measure, which is the tip of your thumb. That's about a teaspoon of fat. And so that should be used to measure oils, mayonnaise, and butter. Then you have a cupped hand, which is about a half a cup, and that is used to measure things like beans and potatoes. We also have the Caribbean My Plate. So this was developed by CAFA, and this method helps to divide the plate into food groups. So what we want you to think of protein, carbohydrates, fat, and fruits and vegetables. Don't overcomplicate it. So half of the plate should be vegetables, and that is your non-starchy vegetables. Similarly, as you see here, we tend to encourage persons to half of that should be cold vegetables, and the other half should be steamed vegetables. And of course, try to choose a rainbow of colors. Then a quarter of your plate should be lean protein, and I'll get into what those lean proteins are. And the other quarter should be whole grains or starch. So those would be your things like your rice, your ground provision, your bread, and your pasta. So it should be a quarter of your plate. So My Plate encourages balanced and structured meals, and that is especially important for those who restrict or binge, right? And it visually shows what a healthy plate should look like. Then we also have the complex carbs. To keep the brain and nervous system functioning at their best, the body needs proper nourishment. This includes a balanced intake of carbohydrates, protein, and essential minerals. And all of those play a role in your brain health. Complex carbs are key foods that support mental well-being. They include things like brown rice, quinoa, millet, beets, sweet potatoes. So these are things that have a higher content of fiber in them. Unlike sugary snacks that cause quick spikes and crashes in energy, so those would be your simple carbs, complex carbs digest slowly and provides a steady source of fuel for the brain. They are also packed with nutrients and help to make you feel fuller for longer, making them smart when it comes to the smarter choice when it comes to your mental health. Also, it's also very important for you to kind of understand the healthy habits or healthier lifestyle habits or choices. So in terms of understanding those fats, so as I mentioned, omega-3s are very important, right, when it comes to your brain health. So the unhealthy fats would include things like your saturated fats and trans fats. All right. And these are things that are linked to obesity. These are things that are linked to inflammation, and that can affect your mental health. So saturated fats include things like butter, and those tend to be very solid at room temperature. They include things like processed meats, so things like salami, things like deli-style turkeys and hams and bacon and sausages. And you know, in the Caribbean, we're accustomed to eating these types of meats options. You also have things like pigtail and pig snout. Those are processed meats. You also have mayonnaise. So these are mayonnaise that are made from full fat animal products. Then pastry, so anything that is made with butter that also has unhealthier fats, and those would be things like hydrogenated fats, and these are more man-made fats that could affect our health in a negative way. It could affect your heart health and of course your brain health. We also eat a lot of fat in typical things like your garlic breads. You eat a lot of fat in terms of your scallop potatoes and your macaroni pies, which we tend to make with heavy cream, or we're gonna make them with cheese, or we're gonna make them with full fat milk. So all of, as well as butter. So all of those things are unhealthy fats. Right. And you also have things like cheesy, creamy pastas, cakes that are made with fat or butters, as well as chicken, fried foods, and Johnny cake. So it's not to say you can't enjoy these things. You have to find a way to substitute these unhealthy fats in your diet. And of course, when it comes to those omega-3s that we do need, you get them in things like unsaturated fats. So those things come from plant-based oils. So they tend to be liquid at room temperature. Just make sure when you're choosing oils, read your nutrition label. Make sure they don't have any hydrogenated fats in them or partially hydrogenated fats. So good ones would be olive oil, canola oil, avocado oil, walnut oil. You also have avocados as well, high in fiber, high in good fats. You have nuts, all the different types of nuts, unsalted, of course. You also have chia seeds, flax seeds, as well as fish or fatty fish. In terms of practical, how you could implement this in your day-to-day life, when it comes to your lean meats, you try to select things that don't have as much fat on them. So those would be things like your chicken breast or your meat substitute. So that could be something like your beans. For persons who are vegetarian, beans as the protein choice, or tofu. And you also have turkey as well. If you're preparing meat, try to cut off as much fat as that you could see. And if you're seeing any fat on the surface, try to scoop that off. You also have the fresh fish. You could use fresh fish, but of course that may be an area, something that may trigger people, especially when you do have anxiety. You may not want to have to prepare that, so you may want something that's more convenient. So if you're unable to prepare it on the days that you do feel good, you could also use canned products. So canned products such as sardines, salmon, as well as tuna, which are healthier. These are fish that are high in omega-3s, and they're very healthy for you. Try to choose those that are in water. Then you also have sodium. So just be mindful that certain products do have twice the amount of salt in them. So just be able to identify certain things, which tend to be cubes, all-purpose seasonings, those processed meats, cheeses, and so forth. So what you want to do is try to select the sodium option. What you want to do is cut back on the cubes and so forth, and focus more so on your natural seasonings. And these are also things that are very high in terms of anti-inflammatory. So these would include your dry herbs like turmeric. These would include things like cinnamon. Those include your garlic, your onions, your thyme, your rosemaries, and so forth. So try to use your backyard seasonings to add flavor to your meals while you're cutting back on the salt. And the recommendation is 1 teaspoon of salt per day. Then also be mindful of when it comes to obesity, a lot of us may be drinking a lot of our calories. So things, Jay?
No, I didn't want to cut you off here, but when you started talking about the foods that we should limit, girl, you got so many comments here. So I wanted to bring them up before we get a little, too far from them. A lot of people were looking for this part of the presentation, I'm sure. So one person, which I thought was really good, said the handy portion guide is quite practical and innovative. Thank you for bringing this to our awareness. I agree. I was here measuring with my hand when you showed that. That was really good.
You're welcome.
Another comment was, yeah, thank you. Another comment was not the oxtail and not the macaroni pie. Yeah, we have to give that up, huh?
Yeah, those are things that tend to be higher in the unhealthy fats.
Yes, yes. Another comment said, I just finished my breakfast, which consisted of Johnny cakes. Now I'm wondering if my breakfast was as healthy as I thought it was. LOL. Many comments there about the food portion. Very interested in it. Thank you, Genesia.
Thank you so much. Okay, so then here now we would, in terms of your sugar, so sometimes we are drinking a lot of our calories. Sometimes we look at a beverage and we think, okay, well, it's just a drink, and you drink it and you're not even satisfied. Maybe you could go for 2 or 3. But some of the beverages, these are sugar sweetened beverages, and those include things like soda, fruit drinks, sweetened teas, coffees, flavored water, coconut milk, and sports drinks. So they tend to be very, very high in calories as well as sugar. So it's like you're drinking your calories, right? And these are empty calories. They have little to no nutrients in them. So we have to be very mindful of the amount of calories we are drinking, and they could also result to overweight and obesity. And so we have to be mindful in terms of our recommendations. Of course, we try to encourage persons to drink more water. And the recommendations are newborns should have 0 teaspoons of sugar per day. Toddlers and preschoolers, 3 to 4 teaspoons of sugar per day. In terms of children, ages 4 to 8, 4 to 5 teaspoons per day. Preteens and teenagers, 5 to 8 teaspoons per day. Adult women, 6 teaspoons per day. And adult men, 9 teaspoons per day. And you have to be mindful that other foods that you eat are providing you with sugar throughout the day. So just imagine how much calories we are getting by simply eating or drinking our sugars. So be more mindful of that, because it can increase your risk for obesity and these issues when it comes to mental health. In terms of some practical strategies for your meal planning, here are some tips to increase fiber or those complex carbs. If you're making soups, try to add vegetables to them. You could add your cabbage, you could add kale, bok choy, you could add onions, beans, carrots, okra. Try adding as much or more so heavy on the vegetables versus the meat options or the ground provisions. When it comes to smoothies, you can also add in things like those chia seeds or flax seeds or your rolled oats or psyllium husk, which is a fiber, very potent in terms of fiber, the fiber content. Beets and berries, which are more so on the low glycemic and they don't have too much, they wouldn't spike your blood sugar. Things like papaya, and also adding in vegetables to your smoothies. Then when it comes to porridge, so we are accustomed to eating porridge in our culture. So we have to understand the difference between the different types of porridge as well. So steel cut oats and rolled oats, they have more fiber in them versus the 1 minute oats. So of course, we would encourage you to more so focus on the higher fiber oats. The steel cut oats have the highest content of fiber. Some persons are accustomed to giving this to their let's say fowls and chickens and so forth. But these are actually very high in fiber, and we should be eating these types of foods. So other strategies include adding seeds to your porridge or adding berries to your porridge, as well as nuts, especially when you're cutting back on the sugar content to add flavor. Then you also have rice. So typically we recommend persons to buy whole grain or brown rice, but some persons can't afford that. And so if you do have white rice, you can do something to add more fiber or to add more nutrition to it. And so you can either add vegetables, so your green leafy vegetables, if it's spinach, if it's cabbage, if it's kale, you can add that. If you don't have any fresh vegetables, there's also the option of canned vegetables or the option of frozen vegetables. And then, of course, if you don't have that and you do know that you have beans in your cupboard, then you could also add beans. And all of these add more fiber to your meals. We're also accustomed to eating things like cornmeal. So how can you add more value, nutrition value to your cornmeal? You can add in okra to your cornmeal. You could add in, if you don't have okra, you could add in cabbage, or you can eat at the side of your meal that 2 cup tins of vegetables. Then in terms of your healthy snack tips include avoid eating processed snacks like potato chips, which can hurt your concentration. Choose healthy snacks like fruits, nuts, hard-boiled eggs, baked potatoes. You could use chia puddings, or parfaits, vegetable sticks, home popcorn, fruit bowls, and nuts. So these are items that could be your snacks instead. Also, be mindful of where you eat. Avoid eating food in front of the TV. Also, instead of sitting down to relax, try to take a moment, relax instead of being so fast-paced. Chew slowly and don't shop when you're hungry to avoid unhealthy impulse buys. So we are at the end of this session, and so I would like to end on this activity that I would like for us to do. So sometimes it can be overwhelming to think about the changes we want to make or the activities we want to accomplish. They seem too big to work on all at once, which makes it hard for us to get started. To help us with this, we have another self-management tool from the Chronic Disease Self-Management Program. It's called the Action Planning. Action plans allow us to achieve what we want or decide to do by breaking down the activity into smaller, more doable steps and tasks. For example, a person who decides they want to improve their fitness might break this goal into one of these parts at first. One plan could be to do some research on the type of activities you want to do. Another plan could simply be you might want to find a place to exercise, such as a warm water swimming pool or an exercise class. Another could be to start an exercise program by walking 5 minutes 2 or 3 times a week. Or you might want to read about exercise, or you may ask a friend to exercise with you. We do not need to do all these steps at once. Rather, we need to get started by deciding which step we are going to work on this week and exactly how we are going to do it. This is done by making a weekly action plan. So here are the necessary parts for it. It must be something you want to do or decide to do, not what someone else thinks you should do or that you think you should do. Achievable. So it must be something you can expect to be able to do within the given week. Action specific. For example, losing weight is not an action or behavior, but by replacing snacks with fruits between meals, then the result is that you lose weight. Answer the questions. What? So what is the specific action you want to do? For example, walking or replacing junk food snacks with fruits. How much? The time, the distance, and the amount. For example, 30 minutes or 40 blocks or 1 portion. When? So when will you be doing this? The time of day or which days of the week? Will you be doing it during dinner? Will you be doing it on Monday, Wednesday, or Friday? Then how often? So how often in the week? For example, will you be doing it 3 times? We want to avoid doing activities every day. If something comes up, it's better to have succeeded when you say you will do something 3 times rather than to feel like you failed if you weren't able to do it the 6 times. You feel even better if you do it 7 times when you said you would only do it for 3 to 5 times. In terms of your confidence level, the confidence level of 7 or more. So ask yourself on a scale of 0, which is not at all sure, to 10, which is totally sure, how sure are you that you will complete an entire action plan? If you rate your confidence level below 7, you might want to look at the barriers and consider reworking your action plan so that it's something that you are confident that you will be able to accomplish, right? And so the activity that we will be working on, I will be giving some examples, an example of an action plan. Then we will discuss how to make the action plan. So I'll start with an example, and then I would like a volunteer, so someone to, come up with their action plan, right? So come up with something that you think would benefit you, let's say in the upcoming weeks, based on our session we had today. And so we would just give the participants an idea of how easy this is. So for me, my action plan, so my what would be to eat a balanced plate with more vegetables. How much? So that would be the time, the distance, and amount. I would like half of my plate to be the vegetables. When? So that is the time of day. So which days of the week? So I would choose Sunday, Monday, Tuesday, and Wednesday. So that is 4 days. And how often? That is the number of days in the week. I chose 4 days. My confidence level for this is 8. So I would like to have a volunteer. So just remember, action plans must be something you want to do or decide to do, and it must be something that is achievable. So can we have a volunteer to tell us, someone who is brave enough just to tell us, based on the discussion, to come up with an action plan, something you would like to do in terms of your health, and rate it from 0 being not at all and 10 being totally sure. So do we have a volunteer? And I will also go over the steps if you would like. You could raise your hands. So the idea is to come up with an action plan. And by doing that, you're answering the question, what is the action?
Don't be
How
shy.
much?
There we go. We got someone. Good deal. Let's go.
Yeah, I think Jillian Morris has her hand up.
Okay, Jillian, thank you so much for volunteering. Okay, so we're answering what, how much, when, and how often, and then you're gonna give a confidence level. And this can be used, of course, to help in terms of being able to help you throughout the day-to-day in order for you to achieve your self-management goals.
Jillian, you're on mute. So if you come off mute so we can hear your action plan. Jillian, you're on mute.
Or if they'd like, they could also put that in the chat as well.
I think they're on mute. I'm not sure if they realize. Jen, you're on mute. If you want to come off mute so we can hear you. I do think that someone said something in the chat as well.
Yes, so someone put something in the chat. So Marissa, thank you so much. Marissa said her what is that she wants to eat more vegetables. And then her how much is half vegetables, and the time is every day. So she'd like to do this every day. I think she's working through her action plan. So
the answers.
She's done the what and the how much.
Okay. And then you also have the when, Jillian. So that is the time of day. And I guess what we could do here so far in terms of your how much or the time, we have the time. So when it comes to you, coming up with the action plan, you want to avoid every day, because this is our life. There are things that come up. So to prevent you from feeling like you failed, we prefer for persons to do, instead of every day, you do something that's more achievable. So maybe you may think that you are confident that you would achieve it every single day. There are things that come up, and to prevent you from being disappointed, we recommend that it's less than every day. So you would feel rewarded, even though, let's say you do end up completing it every day, you would still feel rewarded, right? So we want to avoid every day in terms of the time or the when. And then the when, well, your when you said is at lunchtime. So Jillian, in addressing the problem, the action plan here is simply to say that that you would just have to adjust the everyday aspect of it. So Amar mentioned that he would start by doing slow exercises like walking to start, and incorporating eating more fruits and vegetables in your diet. Your confidence level is 8. When is now I want to live as long as possible? And if life is not an achievement, then what is? Okay, so the idea in terms of the action plan, what you want to do is list it out in the specific stages. So your what is the specific action? How much, which is the time and the distance, right? Or it could be an amount. When, so when in the day, or which days of the week, and how often, which is the number of days. And you want to avoid every day, because this is our things come up in life. And so it's better for you to have completed some instead of failing because you wouldn't have completed the everyday. So the action plan is something that can be used, of course, in order to help in terms of your self-management. And I would like to thank you so much for volunteering and giving your input and feedback in terms of our action plan. So that brings us, of course, to the end of the session. So in closing, it's clear that what we eat deeply affects how we feel, both physically and emotionally. Nutrition plays a powerful role in supporting our mental health, shaping our relationship with food, and even preventing or managing eating disorders. By choosing balanced meals, listening to our bodies, and approaching food without judgment, we can build a healthier connection between the mind and body. Recovery and well-being are not just about being perfect. They're about consistency, self-compassion, and getting support when we need it. Whether you're supporting someone or you're on your own journey, remember, every small step towards balanced eating is a step towards better mental health. So thank you so much for joining today. Thank you so much for your feedback and your interaction. And of course, we do have the question and answer for anyone who would like to ask questions or get any clarification. So thank you so much.
Genesia, thank you so much for that. That was an amazing presentation, an amazing workshop for our Booster Resilience. I thank you so much. I'm going to go through the chat a bit to see if there are some questions. However, I do see a lot of people through with their action plans. But keep in mind, we are going to send this this link to you, so you'll actually get the steps that she was speaking of, and you'll kind of get them in real time. So Abby, if you don't mind looking at the chat and seeing if there were any questions. And guys, you can go ahead and continue to post your questions. We do have a few minutes for the webinar. Were there any questions that have come up besides the action plans? Any questions that have come up?
Yes. So we have a few questions. I think I saw one. Sorry, one question. So the question is, there seems to be so many different food plates. I've also seen the Caribbean food groups plate that has the staples as almost half the plate, and fruits and vegetables about a quarter. So I'm wondering if you could provide some further guidance on how to choose the right one.
Okay, so in terms of the Caribbean food group, so the Caribbean food group, if I'm correct, so it's more so just giving us an idea of, in order for us to get the right amount of nutrients, we are encouraged to eat all foods from the food group. Right, so we're encouraged to eat all foods that in order for us to get a balanced diet. So whether it be proteins, whether it be food from animals, whether it be staples, fruits and vegetables, nuts, legumes. So we are encouraged in our diet to incorporate those items to get the right amount of nutrients. However, of course, sometimes we may be unable to do that. And so you can do different, because certain foods have, for example, certain foods may have protein and they may also have sugars in them, right? And it may be a staple. Certain foods may be carbohydrates and they have proteins in them. So there are certain foods that you can still are groups that you could still combine and be able to get the full benefit from it. In terms of the different plates, so the idea of the plates, for example, the Caribbean plate, you do have the American version of their plate, but the idea of them tend to be similar. If you're speaking on, let's say, diabetes, we tend to say half your plate should be fruit, half your plate should be non-starchy vegetables, right? And these are recommendations that eat not just specific for someone who has diabetes. We as individuals who may not have any chronic disease would also benefit from eating a plate that is higher in terms of your vegetables, right? So even though you may see the American plate, the CAFA came up with the Caribbean plate just to reflect what the Caribbean diet, things that we typically eat. And the American version may not have, for example, stew chicken. Maybe the American version may not have, let's say, plantain or ground provision. CAFA came up with the plate, and there are more options in terms of the variety for the Caribbean plate. It gives you a more realistic view of the Caribbean reality or the things that we do tend to eat. But the concept and idea is similar.
Thank you, Genesia. Another one came in about starchy vegetables. Abby, would you mind reading that one, please?
Sure. So the question was, during the presentation, Genesia used the expression non-starchy vegetables. What are examples of non-starchy vegetables and what are examples of starchy vegetables?
Okay, so starchy vegetables would be those vegetables that you would say having the starches or they may having sugars, right? And those would include things like your ground provision. So those would be things like, let's say, your dasheen, your potatoes, your sweet potatoes, your green bananas, the breadfruits. So those are idea of things that are starchy. And what they tend to do is when we eat them, especially when it comes to things like, let's say, white potato or dasheen, cassava, those things have sugars in them. So even though it may not taste sweet, when we do eat them, it produces glucose in the body. So they could actually spike up your blood sugar. And so that tends to come in the form of ground provisions. And then you do have the other option of the non-starchy vegetables. So non-starchy vegetables tend to be things that they don't have the quantity of sugars in them. They primarily consist of green leafy vegetables, or you may also have things like bell peppers and so forth, your colored vegetables that don't have those starches in them or those sugars. These tend to be categorized as free foods. Whenever you eat them, they wouldn't spike your blood sugar like ground provisions or the starchy foods would. And those would be things like your cucumber, your broccoli, your cauliflower, lettuce, kale, bok choy, spinach, those types of vegetables.
Thank you, Genesia. Thank you so much. Are there any other questions for Genesia? Give it just a few minutes in case you think of something, but also keep in mind, we will be sending this out to everyone who registered and everyone who participated. So I do want to thank all of you for coming out this morning and participating in our workshop. Thank you, Genesia, for the insight and the truly important presentation. It's clear that the relationship between what we eat and how we feel is deeper than we realize. And today you definitely brought more light to it, into just being mindful into what we eat and how to feel empowered in our wellness. Will the slides be provided? Yes, you'll get the entire presentation. So everyone that joined us, thank you for being here and engaging with us today as part of our Roots to Resilience mental health program. And this goes on until July. We do have a few other webinars and in-person workshops for our Roots to Resilience mental health series. And we hope that this session has inspired you to reflect on how nutrition supports not just your body, but also to your mind. I also want to bring up that here at Lake Health and Wellbeing, we talked about action plans, and I saw some of them pop up with being active and eating better. So resuming in July, Lake Health and Wellbeing, we do offer yoga classes. We'll resume that in July. And we also offer a weekly walk around the Frigate Bay Golf Course. Those will resume in July, so you are welcome to come to that as we give those. Also, you can head to our website, lakehealthandwellbeing.com, for all the information of what we do here in St. Kitts and Nevis and beyond. You can follow us on all of our social medias. That's Lake Health and Wellbeing. And again, if you have any questions about our mental health roots to resilience, if you need resources, please reach out to us. Also, Genesia mentioned getting help from a registered dietitian. You can get a referral from your doctor, and Genesia is here in Nevis, so you're able to see her and get that information. If there are no other questions, I thank you all for joining us today, and until next time, take care, and thank you for joining today. Bye-bye. I didn't realize
good afternoon.
There's still some things popping up. I love it. Thank you guys for continuing to comment. Go ahead, Genesia. I'm sorry. Keep going.